So in these sessions, I would like to talk about the sleep apnea syndromes. And then title is Antioxidant Treatment for Sleep Apnea. Sleep apnea was originally mentioned in that Charles Dickens novels, 1836, it's a long time ago. And what he mentioned about is a really fatty man is very sleepy in the daytimes. And then before, this disease was named the Pickwickian syndromes. So obstructive sleep apnea was called Pickwickian syndrome because Joe the fatty boy, who was described by Charles Dickens in the Pickwickian papers, had a typical feature about snoring, obesity, and sleepless. Okay, and then now sleep apnea syndrome, SAS, is during sleep, you cannot sleep deeply, and then snooze, and then that's caused drowsiness and fatigue during the day. And then the work efficacy is greatly reduced. And then risk of developing major problems such as car accidents and traffic accidents is 2.4 times higher than that of the normal ordinary drivers. And then just in Japan, 1.5 to 3 million patients exist in the worldwide. It's a huge numbers. And the economic loss estimated USD 230 billion USD per year. It's Japan only. So that you can imagine that in the worldwide, it's difficult to imagine how much we lost. And then as you see the Pickwickian syndrome, there is obstructive sleep apnea. That if you sleeping, your tongues going down and cannot breathe enoughly. But no obstructive sleep apnea exists. Now this is a major part of that patient. And no fatigue, but increased inflammation and oxidative stress. And then somewhere inflammation might exist. In this patient, micro CRP, inflammation parameter, and then oxidative stress increased. So this this paper shows obstructive sleep apnea as a risk factor of stroke and death. After the 6 years of sleep apnea, and many people cause a stroke and then die. So compared to that healthy patient, risk of the stroke is very high. Here is the 2 cases of sleep apnea tragedy. One is Exxon Valdez oil spill. It was happened in the 1989 in Alaska. And then oil tanker, Exxon Valdez, was collapsed and then spilled the oil a lot. And the first officer of the ship was at night watch, and then but falling asleep due to that sleep apnea. And then the next one is Space Shuttle Challenger. And the Space Shuttle Challenger at 1986 was broken apart 73 seconds. And then person who developed some device to control that gas had the problem of sleep apnea, and then he cannot do the precise work, and then it caused this tragedy. So anyway, you can imagine that only 2 accidents has a huge economical damage and then loss of that human life. So oxidative stress is originate by gas NOx, but it quickly changed to the different materials. So here is a typical two final products. One is the hydrogen peroxide, one is hypochlorous acid. These two ingredients was made in our bodies, and then a white blood cell, neutrophil, use these ingredients to eliminate the bacteria or a virus. So in that meaning is oxidative stress is protecting our body with immune systems. However, if you touch the hydrogen chloride, hydrogen peroxide is a detergent of the cross washings, your fingers turn to white and start inflammations. So excess oxidative stress means whole your body comes inflammations. So I developed that Twendee X, and the first was alcohol metabolisms, and then after that glucose and lipid metabolism, and then oxidative stress reductions. And I have to have this patent because it is easy to copy. So this is active ingredient of Twendee X. It's a glutamines, vitamin C, cysteine, coenzyme Q10, succinic acid, fumaric acid, riboflavin, and niacin. And then very popular ingredient. And you can find that these in the drugstore, the multivitamin or multiprotein, something like that. So it is easy to copy, but to development is very difficult because I put in that many candidate of the ingredient and subtracted and added and finally decided this recipe. Hydrogen peroxide level is easy to measure by these machines, and then this experiment is mice, and then the 3 days administration of that supplement, and day 4, 6-gray radiation was administered to mice. This is almost fatal dose, and the blood sampling at day 7. And vitamin C high dose shows a little bit effect, but no significant. Resveratrol, this is the polyphenol from that popular from the grape seed or grape skins, and it's increasing. I thought this experiment might be failed. And then because the resveratrol is very well known, it's an antioxidant. So I showed this data to the Ms. Miria Richetti of the Louis Pasteur Institute in Paris. She's a top scientist of that oxidative stress. And what she says, oh, this data is correct. What? Because polyphenol, single polyphenol was administered in animal, human or mice, that increased that oxidative stress. If you use for the polyphenols to reduce oxidative stress in animals, use many polyphenol and then small amount. So some people believe that the resveratrol or some polyphenol is very good for your health, but this is no good way. And then the Twendee X reduces this radiation-induced increase of the oxidative stress to that 1/3. And then this experiment is 7 days experiment. So all day, 7 days administered Twendee X reduced at ROS before the experiment. That meaning is very, very strong anti-oxidative stress. So this data is coming from ICDD, French company doing that oxidative stress research. And then Twendee X reduces that 63 to 45% of that oxidative stress, and then increase SOD, that fight with that oxidative stress, mitochondria 147%, and then cellular 60%. So here is some data of monitoring questionnaire things. And this is pollen allergies, pollenosis. And then that is cause inflammation in the nose. And then this is a twice experiment using the Twendee X. And the first one is 2016, the 4 weeks, Twendee X. And then people with the pollenosis answered improved 36% and partially improved 52%. This is over 80% patient was reduced symptoms. And the same thing is 2017 and improved 24% and partially improved 57%. Anyway, this allergy is caused by oxidative, partially oxidative stress, because that if your body's oxidative stress is high, your immune balance is going to wrong. And another data is same as that chronic sinusitis. This is nose inflammations as well. And then this question monitoring is also show that improved 26% and partially improved 51%. And that meaning is inflammation of nose or throat is improved by a Twendee X administrations. So this is the data of Twendee X, and then this data was conducted by a professional doctor, and the patient stayed one night for the control data, and then 2 weeks or 4 weeks after the Twendee X administration, the patient have to stay hospital in overnight. And then this monitoring shows snoring scorings. And then 10 patients, within the 10 patients, 7 patients improved the snoring score a lot. That meaning is respiration stopping time is reduced. So I want to introduce one case of age 62 males. He suffers SS over 5 years, and then the CPAP therapy was effective. But do you see that in this slide, CPAP need attach that nose and the mouth covering, and then the machines heavy, sound noisy. Many people does not like to bring this to that holiday tours, of course. And then this patient was start taking the Twendee X. And after 5 months, listen to CPAP is very clever, and then CPAP monitor that all data during that usage. And then his sleep stopping time was originally over 90 times. This is really critical. If he did not use the CPAP, maybe die within 5 to 7 years for stroke. And then his stopping time was reduced to the 2 times per night. And then now he's happy, no more usage of the CPAP. Okay, and conclusions. And sleep apnea syndrome is one of the oxidative stress disease. Antioxidant therapies are effective for sleep apnea syndromes. Thank you very much.